Do you want to know more about Goldilocks procedure or Goldilocks mastectomy? In this video, I'm going to share with you the top 5 things I think you need to know about this surgery if you're thinking of having it done. Hello there. I'm Dr. Wai-Yee. I'm a board certified plastic surgeon. I specialize in breast reconstruction and breast rejuvenation. I've performed several thousand breast procedures. I'm originally from London, but I now work in the busy cancer center here in Los Angeles. I've been performing Goldilocks procedures for more than 10 years, and I'm happy to share my insights into this procedure based on my experience. So the top 5 things I'm going to go through one by one are: number 1, what is a Goldilocks procedure? Number 2, why is it called a Goldilocks procedure? And that's probably the commonest thing I get asked about this. Number 3, who is the ideal candidate to get a Goldilocks procedure? Number 4, what are the pros and what are the cons of this procedure? And finally, if you get a Goldilocks procedure, can you then get enhancement down the road? So firstly, what is a Goldilocks procedure? Well, Goldilocks procedure is just a form of autologous breast reconstruction, meaning we're using your own tissue after a mastectomy has been performed. We use the remaining skin and a little layer of fat that's left over, and we rearrange it in a clever way, much like a breast reduction, to make a small breast mound. The scar is typically like a breast reduction. It's what's called a Wai's pattern incision, or an upside down T. And if you stick around to the end, I'm going to show you some photos of a case that I did. Secondly, why is it called a Goldilocks procedure? Well, it's a middle of the road kind of procedure, just like Goldilocks and the 3 bears. It's not too little, it's not too much, it's just right. So in breast reconstruction terms, too little would be going flat, where you don't get breast reconstruction. And I've got to say, a lot of my patients, they may not want a breast mound, like a big breast, but they also don't want to be concave. And that's one of the biggest fears of patients thinking about having a mastectomy. So too much would be the traditional forms of breast reconstruction, such as implant-based reconstruction, or flap procedures, such as taking the tissue from your back, what's called a latissimus flap, to build you a breast. And why would anyone do that? Well, the traditional forms of breast reconstruction tend to take longer, and the Goldilocks procedure is much quicker a procedure. So thirdly, who is the ideal candidate? Well, it's those people that are not the ideal candidate for the traditional forms of reconstruction, such as someone that is a poorly controlled diabetic patient who is going to have a high risk of getting an infection if you put an implant, or a patient that has had heart problems, and you're not going to subject them to 6, 7, 8 hours to do a flap-based reconstruction. Also, because we're using the leftover tissue, they have to have a certain breast size, because if you have, for instance, an A-cup breast, you're not going to have a lot of tissue once you've had a mastectomy. We won't be able to make you much of a breast, and it's probably not worth it. Fourthly, what are the pros and cons? Well, I've already said some of the pros, which is, it tends to be a faster surgery than, say, a flap-based reconstruction. You're avoiding infection in one sense, because you're not using an implant, you're using all your tissue. The other thing is the size. You're not going flat, you're having somewhat of a breast mound. So the cons are, you're not that big. You're only going to have so much tissue because of what's left over, because a mastectomy has been performed. And what I find with these surgeries is, in general, people have less upper pole fullness that you would otherwise get with, say, a traditional implant-based reconstruction. So lastly, number 5, can you get enhancement after you've had Goldilocks? So let's say, for instance, you decide to have the mastectomy with a Goldilocks on the same day. Can you then get this enhanced if you're not happy with the result? Well, the answer is yes. So the commonest complaint after Goldilocks, and there aren't that many to be honest, is that you're not big enough, or there's not enough volume. So there's one of 2 things that we can do at that stage. Number 1, we can do autologous fat grafting, which just means that we liposuck, usually from the abdomen, and then we inject it back in as a kind of filler to increase the volume of the reconstructed breast. The second option is to put an implant in. However, remember that many patients are not good candidates for implants in the first place, which is why they were offered a Goldilocks, and therefore putting an implant may not be the best idea. So this is a 63-year-old lady who had a mutation that put her at much higher risk of getting breast cancer, and so she was opting to have a double mastectomy. For many years now, she'd been having problems with heavy breasts. She'd been having pain in her shoulders and her neck and also the upper back, and she requested to be much smaller. She didn't want to bother with implants. She certainly didn't want to have autologous breast reconstruction, and so we decided to do bilateral or double Goldilocks procedure. In this picture, what you see is the patient has had both side mastectomy, and on the same day, I did what's known as immediate reconstruction, and I did the double Goldilocks procedure. You can see that she has smaller breasts, however, they are well shaped, and in fact, she feels lifted and she's very happy with the surgery. You do see the typical upside down T that you see with Goldilocks. The horizontal scar you can't see because it's actually hidden underneath the breast, but you can see the vertical scar, which has healed really well. Typical to a Goldilocks, you don't see the upper pole fullness, but you do have the really good breast shape along the lower pole, giving her a teardrop shape, and she's happy with the procedure. So in summary, the Goldilocks procedure is a form of autologous breast reconstruction using the leftover tissue after mastectomy is performed to recreate a small breast mound. It tends to be a faster procedure compared to, say, a flat-based reconstruction, and it's less risky because we're not putting an implant, there's no foreign object, it is 100% using your tissue. So if you're thinking of having this reconstruction, definitely speak to your breast surgeon and also your plastic surgeon to see if this is a good fit for you. If you've liked and enjoyed this video and found it to be helpful, please hit like and subscribe to my channel, and I'll see you at the next video. Bye.